2000.
The latest advances in feminine health are making it easier than ever to live your best life. Here with details is Dr. Russell Bartels from Scottsdale Center for Women's Health. Good to see you.
It's good to be back and talk about some advances in women's health.
Yeah, Dr. Bartels, tell me a little bit about some of the common feminine health concerns that you see in your practice.
Well, the two procedures that we're going to talk about today, the FemiLift vaginal laser procedure and the O-shot platelet-rich plasma injection, are great at addressing some of these common issues like vaginal dryness, painful intercourse, vaginal relaxation, decreased orgasm and sexual sensitivity. And so bladder leaking is a huge issue that women face, and up until more recently, there haven't been great options for these women.
So what are some of the solutions for these problems? Are these two procedures the most common?
Well, they are the newest, and I would say the most preferable. In the past, say for bladder leaking, which is a huge problem, there's been a bladder sling surgery, which requires surgery, the downtime that goes with it, and the potential risks. And I think a lot of the women listening to this broadcast will be familiar with the bladder sling and some of the controversy surrounding it. And so now we have two great options, both the FemiLift vaginal laser and the O-shot procedure, which are done in the office, no anesthesia. Well, we do numb up for the injection, but they're wide awake. There's no downtime, and they get on with their day. There's really no restrictions and zero complications, and a great solution, because bladder leaking is a problem that no one wants to live with. They don't really want to discuss it either, so it's kind of our job to kind of discuss these things that they might not want to and offer these great new solutions.
And kind of a less invasive
Much less invasive, less invasive. And a great option for women who are suffering from vaginal dryness and painful intercourse, who are not candidates for hormone therapy, which can usually take care of that problem. So we're talking breast cancer survivors, uterine ovarian cancer survivors that are told they shouldn't use hormones to treat those conditions, and these are non-hormonal excellent treatments that'll cure that. And the FemiLift laser is probably the better choice for the vaginal dryness and painful intercourse. It's a laser resurfacing of the vagina, so it does help with the bladder. It helps rejuvenate the vaginal tissue, enhances sensitivity, tightens the vagina a little bit. And the O-shot is an injection of platelet-rich plasma, which is full of regenerative cells, which help enhance orgasm and also enhance bladder function. So they're two great procedures as standalones, but I get such great synergy and best resolution of the symptoms when we combine them both, and they can be done at the same time.
Okay, that's what I was wondering. Are these things you can do together? And you can. What about downtime with these procedures?
They get up and go play golf, hop on a plane. I mean, those are the things.
The same day?
Same day. Those are the things that patients of mine have been doing. I mean, we just say avoid intercourse for 3 nights, and that's really just overkill and just precautionary. There's really no patient who's not a candidate, although we would say if they have significant stress incontinence, this might not be the best option, but they might want to avoid a surgery and still give this a try. And I've seen severe incontinence improve with this. They're really just great options for patients who are looking for solutions for these problems.
And are there any complications that people need to know about with these procedures?
These procedures have been around for about 2 years, both of them. And with the O-shot, the platelet-rich plasma, the studies have been done on over 10,000 procedures, and there's been 0 long-term complications. There might be a little sensitivity or little something that the patient is mildly bothered by. I haven't seen it in any of my patients, but 0 long-term complications. And as far as the laser procedure, the FemiLift, the complications are extremely, extremely rare, and I can't even think of any that come to mind. Maybe a slight little discharge after the first couple of days, and it's gone. So these are just fantastic solutions for problems that have been around for a long time, just great new solutions.
Gotta love technology. Yeah. And you've got a special offer too right now.
Yes, we're offering 20% off both of these procedures, individually or when combined together.
All right, thank you so much for being here.
My pleasure.
And if you'd like more information on Scottsdale Center for Women's Health, visit them online at scottsdalewomenshealth.com or call the number on your screen.